Hello, good morning. My name is Anne Jamaludin. So today I'll be presenting on the topic intergenerational mental health issues, parenting guide. So a little bit about myself. I am currently attached to Help University as a senior lecturer in the Department of Psychology, Master of Counseling Unit. Although public health is my background, but I am also a licensed and registered counselor and also a practicing clinical psychologist. So let's dive into this. So for today's topic, I will cover the definition of intergenerational relationship and what is intergenerational mental health and also the global prevalence of mental health disorders among the elderly, impact on the family, and what can we do. So the definition of intergenerational relationship is a chain of relationship between the aging parents, the adult children, and grandchildren in a household. So as society changed over time, so does the family ties that change with times as well. Like for example, during our grandparents' time, the way they deal with the family is different in terms of how they perceive mental health. So during that time, mental health awareness is pretty low. Our parents' time somewhat similar, and then it's our time where more awareness are there in terms of the awareness on mental health among the elderly, and then our children's time as well. There'll be more awareness on this, where more people are understanding what is mental health disorders and how does it affect the person within a certain age, especially those within the aging population. Yeah. So what is intergenerational mental disorders? So children whose parents has mental health problems are more likely to present with similar problems themselves. So there has been consistent evidence to demonstrate that parental mental disorders affect almost every aspect of child development. So just imagine if your parent is having, let's say, major depressive disorders, or maybe bipolar, or could be general anxiety disorder, worst case scenario, schizophrenia, or hallucinations and delusional type of disorders with psychosis. And then you grew up with that, and then how does it impacted you, traumatized you? And then later on, you also started to manifest similar symptoms as your parents. So how does that impact your children? And imagine if all of you are living in one household, how difficult and challenging would that be for all the family members? Okay, which we will talk a little bit more about it after this. So what happens here, it affects the mental health and the emotional health of the children because they have to sit there and experience this on a day-to-day basis. And it's, definitely quite traumatizing for them, and it will impact them as they grow as an adult later on. And there are studies showing that children of parents with mental disorders would present a greater risk of psychological problems due to the effect on their mental health than their emotional health growing up within that systemic type of household with all of this that's happening. Okay, so let's have a look at the global prevalence of mental disorders among the elderly population. According to WHO, it is estimated that the overall prevalence of, let's say, depressive disorders among the elderly generally varies between 10 to 20%, depending on the cultural situation. So how do they perceive depression? In some cultures, they kind of brush it aside and not really thinking that it is a mental health disorder. Just feeling, oh, they're going through a phase, or they're just being lonely, as opposed to looking at it as a disorder that needs to have provide them with appropriate health and support in that matter. And in the Malaysian context, depression affects 16.5% of Malaysian older adults. This is based on the statistics, I think, from the National Health Mobility Survey. So this probably about 6-7 years ago, the statistics. We've yet to have the most recent ones. And the prevalence of psychiatric disorder in those above 65 is reported as 5% with dementia, 13% with depression, with 4% major depression, and 12% with anxiety states, with 7% phobia. So this is the the psychiatric disorders that has been reported, okay, in the Malaysian setting. So let's give a scenario. Imagine that the grandparents here have depression, have anxiety, or worst case scenario, they have schizophrenia. And they're probably on medication or not on medication. So we know that elderly tend to have, they have a very strong opinion of not wanting to get medication, not wanting to be treated. It's very difficult to get them to seek help. So let's say their ongoing symptoms is there. So the adult children who are, basically their main caregiver have to deal with this on and off type of symptoms that can be overburdening, and there's most time would create a burnout on the child who is taking care of the parents with this disorder. And obviously, as a child who is caring for a sick elderly parent, there would definitely be conflict with the spouse, because all days, most times will be focused on taking care of the grandparents, and therefore other members of the family may be neglected at one point or the other, and that could create conflict between the spouses. So when there's conflict between the spouses and the children are there to experience this and observe this on top of observing what's going on with their grandparents, this could be quite have a serious impact on the child's emotional and also psychological health. And they could also be traumatized by what they are seeing. Their grandparents are going through something that they don't understand, and their parents are fighting over, on the burden of caring for the grandparents. So children are, in a state of, confused, and they're not sure whether is this normal or is not normal. But for them, this is happening on the daily basis. I've had patients coming in saying that, initially she was really scared of her grandfather because she doesn't understand why he was so aggressive. At one point, he was just throwing tantrum. He was throwing things at her mother, and most times she would see her mother break down and cry because she got so frustrated and very a sense of hopelessness in taking care of the grandfather. But they could not send the grandfather anywhere else because there's nobody else to take care of the grandfather. And the family did not want to send to the nursing home. Either they could not afford, or there weren't any nursing home that could take the grandfather, and the fact that that could be financially costing quite a bit is also a hindrance for them to send the grandfather for treatment and also for management in a nursing home. So she said that, it took her a lot of time and to understand the situation, and she had a lot of discussion with her mother. And right now she said they are handling it the best that they can, but at least they're more aware of, what's going on with the grandfather. Why is the grandfather acting that way? So they're much more understanding and much more empathetic in that sense. So they're not necessarily blaming, saying that the grandfather is a bad person or the grandfather is purposely hurting them or things like that. But at the same time, they're trying really hard to get some help for the grandfather. Okay, so this is the scenario. Just imagine you're in this their shoes, and what is the burden on you as a child taking care of an elderly parent with mental disorders, and how it feels like to be a child witnessing all of this happening in your family. Often enough, it will definitely have an impact on you. So what can we do? Okay, so as carers, we can definitely provide emotional support towards our elderly parent. Okay, we should be there and help them the best that we can by getting them the treatment that they really need. And there's option of nursing care depending on the severity of the conditions. You can also encourage your parents to go for counseling or for therapy, either for drugs or non-drug treatment, to seek help, professional help. As parents, we also need to communicate and talk to our children about what is happening, so we can explain to them that they should not be afraid of the grandfather, but they should be more understanding and know that this is not their real grandfather. This is the condition that they are going through. So it's not something easy for them to deal with. Yeah. because we know that as you grow older, there's a lot of neurodegenerative disorders like Alzheimer's, dementia kicks in, which can lead to depression as well. So it just coincide two together, and then on top of loneliness, right? So as member of community, we have to create awareness about the illness, especially among our siblings, among our extended family, and also among the society at large, so that it's not creating a taboo and it doesn't get stigmatized, and that people would be able to work together and support one another if you are having an elderly parent living with you and they are going through these mental disorders, experiencing it, or you have a friend or colleague whose parents are going through it. So they can actually help them, assist them, or actually direct them to a place where they can actually seek help for their parents. So there's a lot of things that we can do. It really depends on how much information we have and how far we go to assist the best that we can. So sometimes providing emotional support to the carer is also good enough as well, so that they can try to deal with the situation the best that they can. All right, thank you so much. That's pretty much my talk for the day. If you have any questions, feel free to ask away. Hope you enjoyed the talk. Thank you so much and have a good day.